Hi everyone, I'm Jacob and we are Symptom SMS. So what's the problem that we're trying to solve in this Ebola epidemic in a low resource setting? Well, imagine you feel unwell, you're not sure if you've got Ebola, you're not sure if you're ill with something else, but you don't know where to go. Or you might know where to go, but that might be far away. You've heard lots of stories and you need advice. You're not sure what the real risks you face are, but you're concerned. What treatment do you need? Now, imagine you are a government health service or an aid agency on the ground delivering support in this crisis and trying to help patients and control the epidemic. So how do you track your suspected cases and how do you triage them? And once you've got resources you want to deploy, where should you be deploying them and how can you best leverage them so that they're helping the most people and so that you're containing the epidemic so that it doesn't spread? I'm going to pass you over now to Mark and Katya to talk about the solution we've come up with.
Thanks very much. So one of the things that we observed about the countries in West Africa is that there's very little internet access, but there is a wide proliferation in the use of cell phones. So we've decided to use an SMS text message-based interface to allow people to assess their own risk of Ebola. In order to do this, we've used the platform Rapid SMS, which was developed by UNESCO in around 2007-2008, which is a free open source add-on to Django, which is part of the Python programming language. So we're now going to demonstrate how we use our message testing, our message interface.
Okay, so we need a volunteer from the audience to be the user. Great. Do you want to come up? So first of all, you'll have seen adverts around about a number you can text if you have concerns about whether you might have Ebola. So what you would do is you would text your name to the service. So what's your name, please?
Joy, J-O-Y.
J-O-Y, Joy.
So then you get asked...
The messages go in here and the answers come up here. So here it says Joy and the reply says, would...
And here, so the...
Oh, no, it doesn't say that.
Well, the first question you would get asked, you'd be sent a text asking you, have you had a fever, temperature, sweats, or chills in the last 24 hours? And you say Y or no, N, yes or no.
Y.
Okay. Next question would send to you, have you had any vomiting, diarrhea, or a skin rash?
Yes.
Okay. And then you'd get sent, have you had any unusual bruising or bleeding?
Yes.
Okay. The fourth question, have you been to a burial or been in contact with anyone who may have had Ebola in the last 21 days?
No.
Okay. And finally, have you traveled to Bombali, Port Loko, or the Western urban area, including Freetown, in the last 21 days?
Negative.
So those are just examples of endemic areas that can be changed.
So, you are at high risk of Ebola. Please stay at home. Make sure you keep hydrated, avoid contact with others, and ensure that anyone nearby washes their hand with soap and water frequently. We will call you in the next 12 hours.
It's okay. So that's the text she would get sent to her phone, because she was in risk category 1, which we deemed to be at high risk of Ebola and also high risk of transmitting Ebola to others. That's why she's going to get to the call explaining how to get to a treatment centre, whether to use an ambulance or whether to use disinfectant kits at home. The second risk category is for people who are at high chance of having Ebola, but not necessarily at high chance of transmitting it to others. The third risk category is for people that sound like they're ill, but it doesn't sound like it's Ebola, and we would advise them to go to the hospital. And then risk category 4 is it sounds like someone who maybe have been somewhere that's at risk of Ebola, say, but they don't have any symptoms, so they'll be advised to monitor and do it again if they have a fever. So many of these options, you are advised to do the risk assessment again if your situation changes, and you'll also have the option to request a call if you're confused. Now Dylan is going to talk to you about the interface.
So that's the user side of our application, but we also have a sort of a cloud-based dispatching system that you can log on to online. So here you can see there are three main, this is a mock-up of our interface, there are three main tabs: a mail tab, an assessments tab, and an analytics tab. Right now we're on the assessments tab. So on the left-hand side here, you see in real time the assessments that are coming in from patients, and these are the automatically generated risk categories 1 to 4. So here we're on this top patient, and so we have their patient ID, which is their phone number. We have their name, which they texted in to initiate our automated system. You can see that this patient did our questionnaire, one time got a level 2, which does not have an output for a phone call or a follow-up, but they're prompted if their symptoms change to do the assessment again. 2 days later, they did the assessment again. That prompts a phone call. And so what happens is we have the cell tower from which the SMS was sent to us. And we have community workers who are unskilled community members who want to get involved and have social capital and understand the culture and the language. And they follow up with people with a phone call to make sure that they're going to the hospital or they know where to go. So what happens is the text message comes into our system. This is a small map of a cell tower here. We know the tower, and that sends out a burst text message to all of our community workers within a 25-mile radius. Then on the phone, the community worker can choose to accept the case. When they accept the case, they're sent a text message with the patient's name, phone number, and risk level. And based on that, our patient record records which community worker it was dispatched to. And when they make contact with the patient, they SMS to this record, and it'll show that they've completed that. And at any time, they can update this record via SMS. So this community worker said patient was compliant and went to Bowtown Hospital for a diagnosis. At a later date followed up, patient was diagnosed with Ebola and admitted to Bowtown Hospital. So that's a general, and we can sort this by risk level. So you can look at all the risk 1 patients. You can sort it by community worker, which community worker has which cases, phone status, who needs a phone call but hasn't been called yet. And so this is our high-level dashboard roll-up of analytics. So it shows all of the cases that have been organized into risk 1 and 4, and an approximation of distribution based on cell tower. These are risk 1 users who need a phone call but haven't been followed up. Sometimes if there's issues with the messaging or it's been flagged, we can have workers log into the system and manually review the algorithm. And the nice thing about that is you can have anyone internationally log on and do reviews. And then we have tracking for confirmed cases. So next I'm going to pass it over to my colleague Elizabeth, who's going to talk about the rollout of our program.
Thanks. So you may have noticed that the area that we've chosen is Sierra Leone. So with that in mind, our rollout is geared towards that country, but everything that has to do with this application is customizable, so you can change it depending on the country that you're in or the epidemic that we're dealing with. In terms of Sierra Leone, they have 2 main cell phone providers. The first is called SierraTel, the second is called Airtel. Airtel in particular already has engagement with the Ebola virus, and they have a free emergency number. So we would leverage off both to develop a relationship with them to help us roll out this system. We would use the local NGOs that are already on the ground and are trusted by the community. These include Red Cross, Médecins Sans Frontières, and Save the Children. They are all operating and running Ebola treatment centers currently in Sierra Leone. We would also work closely with the community to engage community workers, to reach out to possible patients and users of our system. Yep, so that's basically the 3 people, the many different groups that we would use to engage and promote our system. We would also actually use the radio system. So there are many areas have community radio stations that we would use to promote this system. As well, actually, the Terra system, which is an SMS-based burst messaging system, would be used to promote our texting telephone number. I'm just going to pass it over now to Dev to talk about further opportunities.
Hi, I'm Devin. I'm just going to go over a few opportunities that we noticed in ways that we could develop this platform further. So the main opportunity, the main strength we noticed is that this is highly customizable. So whether that's customizable based on the literacy of your users or the language of your users, we noticed that statistically speaking, literacy levels were quite low in the areas we were looking at. However, we noticed quite significant use of cell phones. So we operated under the assumption that if you're literate enough to use a cell phone and use text messages, you'd be literate enough to answer a few simple questions. Having said that, our system is adaptable enough that if we chose to use voice recording system that was in the language of of the user. That would be a very easy system to implement and use in the same automated system. It's also customizable based on the epidemic, so if there's an evolution in the way Ebola or other diseases are growing or spreading, it's very easy to change or tailor our questions to find more information as to what demographics it might be spreading in. Another great opportunity we noticed is that it's a very simple way to reach out and really promote education in terms of seeking out healthcare in cultures where that might not necessarily be as prevalent. And lastly, it's an excellent opportunity to gather data as to how diseases are spreading, under what demographics, and establish a sort of database for a healthcare system that might not necessarily have anything of the sorts in place just yet. I'm going to pass things off to Jacob to summarize.
Thanks, Dev. So this is our product, Symptom SMS, rapid, in situ, scalable risk assessment for the Ebola outbreak. And we'd now like to ask you if you've got any questions about our product and how it works.